Hey guys, welcome back to Medical Coding with Blue. Okay, today we're taking a deep dive into hematomas and blood clots. Now, this is an issue that can get confusing, so we're going to go ahead and talk about it today. As you can see, I have all of the codes that I want to talk about written down, but we're not going to go into that just yet. First, I want to start out with defining certain terms so that we are all on the same page and we understand. Now, this may seem a little bit elementary to some, and pardon me if you get a little frustrated with that, but the thing is, we need to make sure that we are really going over everything so that everybody gets it, okay? I'm going to be reading from my notes. These notes are only going to be available by email. So you have to email me after the presentation so that way you can let me know if you want them and I will email them directly to you. The only reason that I'm not putting them in the description box is because of the simple fact that I want to make sure that all of the other information that I want to put in gets put in versus the stuff that can be emailed directly to you. Okay, so let me know if you guys have any questions, and hopefully we can cover a lot of bases, and hopefully this will start to make a lot more sense, okay? So the first one that I'm going to talk about is, what is a hematoma? A hematoma is a collection of blood outside of a blood vessel. Hematomas are caused by injury to the wall of a blood vessel, which pushes blood out into surrounding tissues. What is thrombosis? Thrombosis is the formation of a blood clot known as a thrombus within a blood vessel. When a blood clot forms in the veins, it is known as a venous thromboembolism. This can also cause deep vein thrombosis and pulmonary embolisms. What is the difference between thrombosis and a hematoma? A blood clot, or thrombosis, is a clump of blood that has formed in deeper tissue or within a blood vessel and is rarely visible. It forms a collection of blood that often clots, which is called a hematoma. A blood clot can also occur inside a blood vessel, in which doctors will call it a thrombus. What is a hemorrhage? Bleeding, also called hemorrhage, is a name used to describe blood loss. It can refer to blood loss inside the body, called internal bleeding, or to blood loss outside the body, called external bleeding. External bleeding happens when blood exits through a break in the skin. Where is the uterus? Now, before you get irritated with me, yes, sometimes we all need a refresher on where in the body certain organs are, right? Or other body parts, and internally, where are things located? It just makes more sense, okay? As medical coders, we are not doctors. We do not poke around on the inside and know all of these things like the back of our hand. So we have to be reminded of these things, okay? So I'm not trying to be like that. I just want to make sure that we cover all the bases, okay? So where is the uterus? The uterus, also called the womb, the uterus is a hollow, pear-shaped organ located in a woman's lower abdomen between the bladder and the rectum. Ovaries, two female reproductive organs located in the pelvis. So the uterus is located in the pelvis, all right? Just want to make that clear. What is the uterine ligament? They function as a support to support the uterus within the pelvic cavity. Uterosacral ligaments. The uterosacral ligaments are also bilateral fibrous bands which attach the cervix to the sacrum. They are also known as rectouterine ligaments or sacral cervical ligaments. This supports the uterus and holds it in place. So basically, it's like anchoring the uterus there. So when you think of it in terms of the ligaments are not the same as the uterus. They're just holding the uterus in place, okay? They are there to function as support. So don't automatically think when you see uterine ligament, oh, that's going to refer to the uterus. it's referring to the supporting structure of the uterus, right? But it's not the uterus itself. So don't automatically pin other words to a diagnosis or to a location, okay? Just want to make that clear. And then finally, what is the porphyrium? The period of about 6 weeks after childbirth during which a mother's reproductive organs return to their original non-pregnant condition. Okay, that's very important to know. Porphyrium, that is that frame of time. Okay, now we're going to go ahead and get into the diagnoses. Okay, so if the provider documents that the patient has a hematoma of the uterus, the way to find that code is this way: hematoma, pelvis, female. If this is non-traumatic, non-obstetric, right, has nothing to do with pregnancy, it's going to be that N94.89 code, okay? Now, if it, we're going to talk about it if it's related to pregnancy in a little bit, but if the hematoma is in the placenta, now we're talking about an obstetric condition, okay? That's going to be O43.89, and I put X at the end because that's usually when you're going to say what trimester they're in, and then plus the weeks of gestation code, okay? Which I give you guys a example of that coming up. But before I get into that one, I don't mean to jump ahead, but going back to this non-traumatic, non-obstetric, that N94.89, sometimes that can occur because of other reasons, okay? If there is a hematoma in this woman's uterus, it could be because she may have a rheumatological condition that's causing her to have a hematoma, or it could be something else. This is non-traumatic, non-obstetric. So that's why you have to be very careful, because if you're talking about a trauma, that's going to be something separate. This one has nothing to do with trauma. It has nothing to do with being pregnant. That's that N code, okay? And then, of course, in the placenta, if there is a hematoma in the placenta, that is an obstetric code. That's going to be that O43.89, and then X is going to be whatever trimester that they're in, plus the weeks of gestation code. You're always going to use those two codes whenever you're talking about a obstetric code, right? And then, or if it's more than that, but just always make sure you have the weeks of gestation code on there, okay? And then you have the traumatic injury female genitalia organ. Then you have that S03.202X, and then I put AD or S, so the initial, subsequent, or sequela. Now, on my notes I have on that one, this is for an external genital organ on a female, okay? They also have the specified injury codes, like if, was the, I don't have the book with me, but if you look in that section, they're broken down a lot more. This is for the external, and this is the unspecified one, okay? That's the unspecified code. All right. So the next one is if the provider says thrombosis in pregnancy, if it's specified, okay, that's an example of O22.8X3, other venous complications, with the Z3A.33 for the weeks of gestation. I just use that as the venous in pregnancy, or the thrombosis in pregnancy, other specified example, at 33 weeks of gestation. Obviously, not every pregnancy is going to be that same way, but this is just an example, okay? So I just use the 33 weeks. That way you could see what they look like together, okay? Now, if this is due to a obstetric trauma, that's going to be something that's different. It is understood that sometimes these traumas happen when a mother is in labor, or is giving birth and things like that. So you're not going to be looking at these S codes. You're going to be still looking at these O codes, And these O codes are going to be broken down more specifically. So if it is due to an obstetric trauma, and hopefully your provider has really documented this well so that you know which one to pick. If this trauma happened while the patient was giving birth, right? Then you're going to go with that O71.7 code. All right. So make sure that you look in there, because any injuries that are specific to birth and in that whole labor period, they're going to be there. So make sure that you look in that section and review if you are in coding for moms, okay? Now, if they say that there's a blood clot of the uterus in pregnancy, okay, this is when they are actively pregnant and there's a blood clot in the uterus, you're going to go with that O88.211 plus the weeks of gestation code, okay? And if they say that the blood clot is of the uterus in the porphyrium, you're going to go with O88.23 thromboembolism in the porphyrium. It includes porphyrial pulmonary embolism, not otherwise specified. So obviously there's not going to be no weeks of gestation on when the patient is out of not being pregnant anymore, right? In the porphyrium, you're not going to have no weeks of gestation code. But that's going to be after, okay? So if there's a blood clot in the uterus after, right, in the porphyrium period, it's going to be that O88.23, okay? So hopefully this has answered some questions and not completely thrown you guys off. I know it is a lot, but just knowing and paying attention to the different stages and the different things and what they mean is really going to make all the difference. Like this non-traumatic, non-obstetric is that N code. And then in the placenta, the obstetric code, then you're going to have like a code like that plus the weeks of gestation. If it's a traumatic injury, not having anything to do with pregnancy, right? Just say, for instance, you know, a woman fell and then she really hurt herself. Maybe she fell off a bike or fell onto a bike or something, and she had a traumatic injury of an external genital organ. Then you're looking at something like that S code right there. So always look in those sections and break it down, but really understanding and knowing the difference between hematoma and blood clot and what they're saying when they say thrombosis and all this is really going to help you to be able to distinguish which is which. Okay, so again, hopefully I have not completely confused you guys. But yes, so let me know if you guys have any questions. Hopefully this cleared up a few things. Like I said, it is going to take some time, and generally, when you're looking at like traumas that are not related to pregnancy, you're going to go down those S routes, okay? And anything related to pregnancy or in pregnancy, review that section in your Optum 360 ICD-10 book. I was going to say ICD-9, ICD-10 book. Review it in there. And there's a lot of notes in the OB section, okay? So make sure that you review those notes. And if you don't have a Optum 360 book, please make sure that you look on other websites or go to Optum360coding.com. This is not an ad, but I'm just saying they have their books there. They have wonderful sales. The other day, a viewer told me that there was 60% off. So I don't know if they're still having that right now, but make sure that you check and check often because like I said, they're always having good sales. And sometimes they have books from the year before. So if you're wanting to get books as a reference, that is a good time to get them as well, okay? And you can certainly, if you're just using it for a reference, you can certainly use the year before. It's going to be a lot cheaper, and you're still going to get a lot of really good information, okay? So just some advice from me to you. So hopefully, again, you've enjoyed this. Let me know if you have any questions when you email me for these notes. Basically, everything that I talked about now is going to be in this little notes thing that I have. So I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.